Dr. Hobbins said the supplemental industry is the reason why so many people are sick. He's like, no one eats organ meat anymore. And how Dr. Hobbins treated all his cancer, breast cancer. I'm only going to get into that a little bit if you want to talk about that. But he treated breast cancer with nutrition. He bought his own cows, Ryan, because Dr. Hobbins fought the industrialization of the milk supply since the 40s. Oh, and by the way, how amazing Dr. Hobbins is. He's the second youngest gentleman to ever graduate from Northwestern, the largest hospital in 1946, medical school. The year he graduated, 1946, second youngest gentleman, he was head of ER, night. That's what a brilliant, brilliant, brilliant surgeon that they recognized in 1946. He fought the industrialization of milk because he was in Wisconsin. He's from Wisconsin, went to Chicago to be a doctor. And he fought the industrialization of milk. He bought cows for his patients. They were called cow condos back then, I guess, in Wisconsin. You all can look this up. I'm not sure. This is just us, 10 years working together. You're going to learn all these like random stories. So he was always telling people, have your own chickens, grow your own veggies, get milk, go over to my little cow condo and get your milk. And the number one thing, liver. Liver. He said everyone's sick because everyone supplements and no one eats organ meat. So Dr. Hobbins, being a doctor, he would prescribe prescriptions. He would prescribe supplements as needed. They were never meant to be long-term. Supplements and pharmaceuticals are medicine. And I'm always reminding people, I'm an herbalist. I studied herbs 4 years. 4 years. How come I had to study herbs, know every property of every herb, know that property against every other herb, so I know I won't mix and hurt somebody, right? Because I now have the ability to hurt my patients because now I know all the properties. And not only that, know what those properties will do in every body type. So people don't understand the power of herbs. And yet I have to go to school for 4 years to prescribe them. And you have an MD and an ND making herbal formulas and just handing them out. So when I tell you that MDs and NDs are harming you with their supplements, it's because they don't realize these supplements have side effects. You just can't take, you know how you hear all the time, like this herb cures cancer, this herb cures cancer, this herb cures cancer. I have my patients write down all their supplements and I'll go in and I'll Google what's in the ingredients. And I'm like, oh, and it's just, they cherry pick these herbs and put them together. But how do you know those herbs work? How do you know you're not harming that specific patient? Does that make sense? Maybe it works for you, but it won't work for me.
Well, I was looking at your website, and by the way, all of Dr. Wendy's information, websites, everything's going to be in the description. So I'm looking at estrogen-free.com in the lifestyle section. And yeah, it was interesting. So some of these herbs that you're telling to avoid are some of the most popular anti-cancer herbs used in alternative medicine, especially mistletoe. That jumped right off the page for me. This is very, very popular to use mistletoe.
Yes. Why do you think I'm shouting, stop using it? Because I'm seeing women will come to me, Ryan, and they're saying, I'm using mistletoe. I'm like, that's an estrogen. You have estrogen receptor positive breast cancer. No, my naturopath says phytoestrogens block. No, they don't. That's not how it works. When I tell you doctors have no understanding of physiology, I can't express this enough. You have estrogen receptor positive breast cancer. It will be stimulated because it's bioidentical to your estrogen. People don't understand terms, Ryan. And this is, the medical industry. Okay, so I wrote this book at a 5th grade level. I talk to women, I believe, at a 5th grade level because I want you to understand the words coming out of my mouth. Doctors, when I talk with doctors, I talk differently. And they use these terms and big words and la, 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 and numbers. And I'm like, that's great. I'm sold. If I didn't know better, I would be out buying all that. But you know what, Ryan? All those women are at risk for breast cancer, and a few of them have cancer. And they never came back to me, and they never referred their patients because they realized they had no idea what they were talking about. Does that make sense? These doctors are harming their patients because they have no understanding of physiology. They have no understanding of what actually increases risk of. Why is no one preventing breast cancer? This book, Ryan, okay, this is it. I make $1 off this book, right? I'm like, this is where I'll make my money because I don't sell supplements. So I'm like, okay, cool. Everyone will buy this book and everyone's going to be healthy. Yay. And I thought I could just, enjoy my little clinic and enjoy my life. And no one wanted to hear the truth. Ryan, when I published this book, I talked about everything was nutrition. Wouldn't you want to know what to eat? I thought, like, as a Chinese medical doctor, I thought, here I am, like, doing the right thing. Come to find out, everyone wanted the pill. And they're like, no, what's the pill? What's the pill? I'm like, the pills are the ones that are causing and increasing your risk of cancer. Now, when I say cause cancer, Ryan, I want to be very specific. When I say flax causes cancer, it doesn't cause cancer. It stimulates the cancer cell. Okay. So if I say cause, I mean stimulate. So it doesn't cause the cancer. You have the cancer cell. What we're doing is we're not expressing it. Oh, and by the way, flax, a quarter cup of flax equals 20 birth control pills.
Yeah, so I wrote down flax here because I'm reading a big cancer book right now. It's downstairs, or I'd hold it up for you. It's by the Burton Goldberg Group, who also released a big giant alternative medicine definitive guide textbook as well. It's pretty popular in my arena.
Okay.
And anyways, it's just, yeah, some of these things come up again and again that you're saying, no. Like mistletoe is one of them, but flax is also one of them that is strongly, highly recommended for its essential fatty acid content. And I'm bigger on fish oil. I don't know how you feel about that.
100%. And that's what I don't. Why does no one contact the researcher? So Dr. Hobbins was the first, I believe now, was the first doctor to warn other doctors about soy, right? Because when I met him in 2008, he was telling me about flax and I was blown away. And it's the very first study I did, and you can watch it on YouTube. That is the most hated video on YouTube. My first ever pilot study was flax because I wanted to know. I wanted to get to the bottom of it because it was hard. Okay, I'm always reminding my patients, I'm deprogramming you. I have to deprogram you. I am not like when I texted you, ask me questions. I want the questions because I know you're coming at me from a respectful manner and I will respectfully answer them. You're not yelling at me like most people. So as long as you ask me, I had to be deprogrammed. I had to ask 100 questions. I stayed with someone for 10 years, Ryan, 10 years to understand this. So I want those questions. So Dr. Hobbins got tired of me though for a little bit. He's like, you know what? You're a doctor. You're responsible for your patients. You should be doing the studies yourself. And that changed everything for me. Because you know what I realized? No doctor is held accountable. If these doctors were held accountable, the truth would be revealed because it would show that they have no understanding of what they're doing when it comes to hormones and breast cancer prevention and low testosterone and preventing gender dysphoria in children. I seem to be the researchers, and I'm the only doctor that I can find. The researchers know what's going on. They're trying to shout at you. They are. None of you are listening. You guys are all hung up on, and I'm not saying you, Ryan. I'm saying, the public, I'm not trying to, like, the one person that wants to listen to me, I'm not trying to upset, Ryan. So thank you for being open, willing to listen, because I understand what I'm saying is overwhelming. But these researchers in the book that I use, I know they're worried, and I'm worried. I've never had a conversation with any of them, the phytoestrogen, the researchers, but I know they're worried because they're probably seeing this and going and not believing it themselves either, because I didn't believe it. So when I'm trying to say is I had to deprogram myself by researching. And if you are a doctor and you care for your patients, why are you not doing your own research you know, in whatever way. And I mean, you have to use medical equipment. My medical, you know, like a microscope, right? My medical equipment happens to be infrared camera.